It's awesome. So yes, we are recording the session. So if you want to share it with any of your colleagues, or if you need to leave and you need to come back and finish it, you'll have the option to do that. And it's 1 o'clock. So we're just gonna jump right in. So my name is Leah Poole. I'm NC CASA's Rural Sexual Assault Services Specialist, and I use she, her pronouns. And so, as you know, obviously today we're going to be talking about supporting parents of teen survivors. And this is a conversation and presentation that I'm really looking forward to talking about, because it's an area that I'm particularly passionate about, and I think is a part of our movement that we don't always talk about. And so a lot of the information is going to come from my own lived experiences, as well as my experience working with parents of teen survivors when I was at a rape crisis center. And so we're going to start today, like we do all of NC CASA's webinars, with some general information about NC CASA. The North Carolina Coalition Against Sexual Assault is an inclusive statewide alliance working in sexual violence through education, advocacy, and legislation. NC CASA uses a social justice framework, which means we do our work from a strong intersectional social justice perspective. And we believe that by centering our work around marginalized communities, everyone is served. Here's just a brief overview of our work. So I'm sure a lot of you are very familiar. I am part of the member services and technical assistance team. And so that part is about connecting with our member programs, which include rape crisis centers, but also different community providers, culturally specific organizations, things like that. And we also provide trainings. We do anti-human trafficking outreach, prevention, education, and we also work with colleges and universities. We want to acknowledge at the beginning of all of our trainings that not all women are victims, not all men are harm doers. Any gender can be a victim, and any gender can be a harm doer. Awesome. So our goals for today are going to be to gain confidence when speaking with parents who have had their teen disclose sexual assault, practice skills related to providing advocacy to secondary survivors, increase knowledge on common responses from caregivers of teens who've experienced sexual violence, and feel prepared to work with parents who have their own history of trauma. So before we jump in today, I just have a couple of acknowledgements. First, that I know that there are going to be survivors in the space today who may have a personal connection to this topic, whether that's because of an experience that happened to you or to a loved one. And so please feel free to take breaks, get some water, or practice some grounding anytime throughout the presentation. Again, this is being recorded, so if you want to come back to it later, that's okay. For this webinar, we're going to be working with a scenario to walk us through the different areas of advocacy that you may encounter when working with a parent of a teen. And so I use the word parent throughout the presentation, but this information can be applied to anyone who is a caregiver. And I'd also like to acknowledge that a teen is anyone between the ages of 13 and 19. So this means that the information also applies if you're working with students on a college campus and their parents following an experience of sexual assault. So before we get started, we're going to do a quick poll, and I'll ask Alexander to get that up and give you just a couple minutes to answer these questions so I can get a sense of, who's in the space. Okay. So here are the results. It looks like a lot of you do encounter parents of teens survivors looking for support from you and your agency. So that's great to hear. Hopefully this webinar will be helpful. It looks like a lot of you are somewhat comfortable with working with parents of teens, and that's great because this webinar definitely kind of comes at it from the perspective that you already have kind of like a baseline understanding of just general advocacy, sexual assault support, and working with survivors. And so that's great that you're somewhat comfortable, and hopefully by the end, maybe you'll feel more comfortable. And great to hear that a lot of you think you would benefit from more support around working with teens in general. So NC CASA will keep that in mind. So of course, doing presentations virtually sometimes can feel a little dry. I am going to ask some questions and hope that folks feel comfortable putting their thoughts, opinions, or experiences with advocacy with this group in the chat throughout the presentation. And, I'll need to pause and get some water. So we'll definitely check in and hopefully have some good discussion. All right, next slide. All right, so like I said, we're going to kind of come at this from a scenario. So we have Dana, and Dana came to your office today and during the intake process indicated that she was here to talk about a sexual assault. There was not a box on the intake form to indicate whether she was a primary or secondary victim or survivor. The advocate comes to greet Dana. Once Dana and the advocate are in the meeting space, the advocate notices that Dana seems a little on edge. The advocate introduces themselves, goes over the agency confidentiality and mandatory reporting policy, and then asks Dana what brought her in today. And so this is what Dana said. Dana begins by saying she's here today to talk about her daughter, Rosie. Dana says that over the weekend, Rosie, who is 16, was supposed to be spending the night at a girlfriend's house. When Rosie came home the next day, she just seemed different, withdrawn. When Dana asked if she was okay, Rosie said, "I don't know." When Dana inquired about this response, Rosie said, "Something happened, but I don't want you to get mad at me if I tell you." Dana became concerned and assured Rosie that she wouldn't get mad. Rosie paused and then shared with her mom that she and her friend ended up going to a classmate's party and that she had a couple of drinks. She woke up this morning in bed with her classmate, but doesn't remember what happened. Rosie said she feels different, like maybe she and the classmate hooked up, but doesn't remember that happening. Dana admitted that after hearing this, she was upset with Rosie. She had many thoughts running through her mind, like what happened? Was her daughter sexually assaulted? How could Rosie have been so irresponsible? What should I say now? Dana saw your organization's poster at the grocery store the next day and decided to come in just to talk it through with someone. Dana is a single mom and doesn't feel comfortable talking to her friends and family yet. So what are your initial thoughts about your interaction with Dana? And you can put your answers in the chat. If Dana came to your office, what would you do? What would you say? Or what would you think? I would think that she's more than eligible for her services, and I would start by making her feel comfortable and safe to talk about how she feels about what happened. Great, that's great, Chelsea. I think that piece around thinking they're more than eligible for your services is important. Different organizations, different programs have different policies. But obviously, we kind of think about Dana here as a secondary survivor, but she's also a parent of a teen. So make sure that you kind of either, like, does your agency have a policy about supporting parents of teens? Do they have a policy about supporting teens in general? Those things are definitely helpful. Something that, I thought about is that when Dana came into the agency, there wasn't a way for her to indicate that she's there because of sexual violence that occurred to someone she knows. So, you might not want to put on your paperwork secondary survivor because some people may not know what that means, but it can feel really validating and reassuring for there to be an option that reads something like, I'm here because of something that occurred to someone I know. Aside from making the secondary survivor feel more welcome, it can also help the advocate prepare with those advocacy skills that might be more appropriate when talking with loved ones or family members. Do most of you have an option on your intake form for secondary survivors, or is this not something you've thought about before? Okay, thanks, Rhonda. So if nothing else from this presentation, anyone else who doesn't have that on their intake, kind of think about why you don't have that, and also, is it worth adding? Again, to make secondary survivors feel more comfortable and like this is the right place for them. I see Chelsea says we do, and when we do intakes, the client is not just filling it out. It's more of a discussion so that we can explain what secondary survivor means. That's great. I think that's a good strategy. All right, next slide. So now that Dana's told you her reason for coming in today, where do you start? When working with parents of teens, even though the primary survivor is their child, it's still important to give them space to process their own feelings, like Chelsea mentioned. Hearing that your child experienced sexual violence can make someone feel confused, angry, sad, disappointed, and similar to survivors that believe it's their fault they were assaulted, parents may also feel like it's their fault that this happened to their teen. They may think they didn't prepare them for this, they didn't give them proper guidance, especially if the parent finds out weeks, months, or even years later, or finds out from a source other than their child. This can cause even more confusion and maybe even some shame for the parent. They may also feel guilt or sadness that their child didn't trust them. That may be what it feels like, that their child didn't trust them with the information. Let the parent feel all of this with you. Validate their feelings and provide a non-judgmental space to react. The parent may say some things that sound like victim blaming, disbelief, or anger directed toward their teen, and this can be hard for an advocate to hear. However, these are normal feelings, and we must allow the parent to explore these. This gives us a chance to lean into what needs or education the parent may need when supporting their teen. Next slide. So once Dana has had time to share her feelings and work on processing what has happened, you may find that it's appropriate for you to provide some education about sexual violence. Depending on the nature of the assault, parents may not always think of what happened to their teen as sexual assault. It's easy as advocates who do this work every day to sometimes operate under the assumption that everybody thinks about sexual violence the way that we do, or that an incident of sexual assault is so clear. But unfortunately, because of cultural messages or just a lack of knowledge on the topic, people don't always recognize sexual assault for what it is. If the parent is saying something like, maybe they just don't remember saying yes to this person, or maybe they're embarrassed and feel like they made a mistake. One, try not to judge these statements, which can be really hard because it sounds really victim blaming. But two, provide some education around sex while incapacitated. Offer something to the parent like, I know this is a lot of information to process, and it's really difficult to hear that your child may have experienced harm. Based on what you've told me so far, it sounds like Rosie may have had a lot to drink at the party, and when someone drinks too much, they're unable to consent. While you may be disappointed at Rosie for underage drinking, it was the responsibility of the person who did this to Rosie to get a clear yes that she wanted to hook up. What do you think? And then give, the parent caregiver time to kind of process that. Maybe they didn't think about it like that. Again, it seems obvious to us, but especially right after, getting this really big news, they may not have had time to think about, consent or understand it. And it's also, sometimes parents may fall into the rape culture trap, that because their teen was drinking, it was somehow their fault or they shouldn't have gone to the party in the first place. If this is the vibe you're getting from the parent, help them understand rape culture. If a parent is stuck on the fact that the assault happened while a teen was drinking or using other substances, was with an older classmate, or had snuck out at the time, remind parents that these are normal teen experimental behaviors. And then discuss how the teen breaking the rules wasn't what caused the sexual assault. The only person who caused it was the harm doer. Ask the parent what they think about this or what's coming up for them as they hear this. It can also be helpful to ask the parent what kind of messaging they received about sexual assault growing up. And if they received harmful or misinformation, this will help you make sense of where they're coming from. So getting a sense of what are Dana's beliefs and views on sexual assault can just kind of help you frame the conversation, maybe help provide some education and redirection. Is there anything else you would want Dana to know so far? And this is a question for y'all to answer. Something you have said in the past to a parent of teens after, they talk about this. Okay, great. Well, we'll keep chatting about it. So next slide. All right, so it's possible that you'll provide support to the parent and never see the teen. And this is when it can be valuable to help parents know how they can be advocates and really good support persons for their teen. And you may have to give them like a crash course in sexual assault advocacy. So things that we know that are helpful when it comes to talking with teens and survivors in general is that you want to match language. There's a lot of reasons teens may not refer to what happened as an assault or rape. They're embarrassed. They don't have the language to describe what happened. They're using language that makes sense to them. If the parent doesn't know what something means, let them know it's okay to ask, and also prepare them for their teen to feel uncomfortable discussing this with them. Most teenagers probably don't feel super comfortable talking about sex with their parents. I think that's pretty normal for a lot of different reasons. And so, helping parents kind of keep that in mind. And then also, parents may not want to do this right away. They may not want to ask, immediately after for all the details, or for, kind of push the teen into talking about it if they're not ready. So allow some time for the teen to process what happened before asking again. Just encourage the parent to match the language of the teen. If they're using hooked up, let the parent know they should use that to make their teen more comfortable. It can be helpful for advocates. This is just an advocate tip, but it can be helpful to stay up to date on teen lingo and trends so that you can understand what parents may not, or so that when you're interacting with teens, you're familiar with the terms they're using. This doesn't mean that you should not ask for clarification or that you should try to talk like the teen if that's, kind of not your natural phrasing or lingo, because the teenager will totally see right through it and they may be like, I don't want to talk to you, you're being weird. But it can just be helpful to have an understanding and feel more relatable. So what can parents say to their teen or support them after they disclose? So for some teens, maybe even more than adults, they may experience embarrassment, guilt, or shame related to what happened. And they also may fear punitive repercussions more if they were breaking rules when the assault happened. And these could be big reasons why they don't want to share. Parents should honor these feelings by ensuring them that they're here to listen without pressuring them to talk about what happened. In addition to saying things like, I believe you, or this is not your fault, when a caregiver is supporting their teen, it can be helpful to say, I love you, and remind them that they're on their side. I think a lot of teens probably feel like their parents may look at them a different way, and maybe that's true. I think sometimes teens may think that, because we know that sexual assault can make us feel so much guilt and shame, maybe the teen will think their parents will love them less. So, saying I love you can just be really powerful, and saying, I'm on your side. As advocates, we can help parents understand that saying things about wanting to harm the harm doer or wanting to seek some kind of revenge is not helpful to the teen's healing and may shut them down, especially if the person who assaulted the teen is a classmate, friend, someone who they see as powerful, whether that's a peer that's really popular or an adult figure, or especially a dating partner. It's normal for parents and secondary survivors to have the response like, I want to get this person, or like, I'm so mad at this person. But remind them that generally speaking, teenagers are not going to want their peers to know what happened unless it's someone they can trust. So if they're worried their parents are going to, quote, get the person in trouble, call their parent, they may lose trust in their caregiver and not want to talk about it at all anymore. Dealing with our emotions as teenagers can be confusing without the addition of trauma. And based on cultural influences through socializing agents like school, media, church, etc., teens may have preconceived notions of how they're supposed to act if they've experienced some kind of sexual harm. And if that's not their response, that can feel confusing or make them feel like there's something wrong with them or lead them to minimize what happened. If your teen talks with you about some of these feelings and responses, let them know that there are many potential responses when something like this happens, and all of their feelings are valid. Next slide. So this leads us to helping parents understand trauma response. If parents' only familiarity with how someone should act after a sexual assault is from TV or movies, they probably have a very limited understanding of the wide range of responses. We know that someone who has experienced sexual assault may become depressed, anxious, sad, reclusive, but they also might become angry or laugh a lot or become hypersexual. And it's also important to let parents know that the responses may change over time or depending on the day. Immediately following the assault may look different than a few months down the road if the teen has had some time to process things. And remind parents that healing isn't linear and there's no timeline for healing. And this will help the parents set reasonable expectations for what lies ahead. Sometimes, especially if it's someone who's never encountered or interacted with someone who's experienced trauma or sexual violence before, they may think like, well, they're acting normal, so I guess everything's fine and we don't need to worry about it. And sometimes people do act normal. Sometimes people do say everything's fine, I don't want to talk about it, that's normal. But sometimes that changes over time, and sometimes people might be really distressed, teens might be really distressed immediately following the assault, but then a couple months later they have employed some really helpful coping strategies, and then things change again. And so just letting the parent kind of know, like, there's no timeline. You're not going to get to a certain day 6 months down the road where all of a sudden everything's like okay and all the problems are resolved and all the trauma responses have gone away. That's not going to happen. And sometimes people don't understand that. And so kind of setting the stage for that can be helpful. And I don't want to go too in-depth here, but when we think about where teens are developmentally, it's normal for them to have the response of not wanting to talk about it at all and wanting to just try to forget about it. Teens and young people are usually focused on school and their friend groups and their peers, and those are the most important relationships to them. So they're going to want to hold on to that and protect it and not allow anything to interrupt. And sometimes, depending on how old the teen is, let's say maybe they're a senior in high school, like their goal is probably just to get to graduation and get out of that town, right? And go to college. And so they may just be focusing on that either as a coping skill to not address the trauma if they're not ready, but maybe in their mind, once they get there, once they graduate, once they leave and go to college, then things will get better. And maybe that's true, maybe it's not, we can't predict the future, but if that's what they're using to cope, and that's kind of, where teens are developmentally, that makes sense that they may not want to talk about it and may just want to try to forget about it. And it's also not uncommon for children and teens who've experienced sexual violence to not want to address it until they're in a different stage of their life. A lot of caregivers may want to push their child to go to therapy or talk to a counselor. And while it may be helpful and parents can present those as options, it shouldn't be presented as an ultimatum or something that is mandatory if the teen's not ready. If we push someone, if we push our teens into therapy, and we talk a little bit about this more later, but not only are we kind of putting someone in a situation they don't want to be in, and kind of taking away some autonomy, which may be reminiscent of the violence that they experienced and the feeling they had there. It's also not super effective to have therapy when you don't want to, right? When you don't feel like talking. So give it time, present it as an option, but it shouldn't be forced. That being said, there are some responses caregivers should be on the lookout for and offer appropriate intervention to keep their child safe. Next slide. It's not uncommon for teens who have experienced sexual violence to utilize harmful coping strategies because they don't know what else to do. Some of these strategies may be self-harm, disordered eating, or excessive drinking or substance use. If parents notice their teen is engaging in harmful coping strategies, recognize that this is them trying to cope with the trauma. It's important not to shame, punish, or direct anger towards them for these behaviors, but try to get to the bottom of what they're feeling and offer alternative coping strategies. Things might be taking a few breaths, journaling, talking to the parent, a counselor, or a trusted friend, using art or exercise. Do they need to spend a couple days at home rather than going to school? If the behavior continues or escalates, then it may be time for parents to intervene and take their child to a mental health provider. Their teen's health and well-being is the most important thing. So as an advocate, it can be helpful for you to be familiar with any providers in your area that specialize in working with teens and adolescents, because if the teen is engaging in self-harm coping behaviors, we do want to, get them the support that they need, and being able to kind of be familiar with what those options are in your community can be really helpful to a parent. So I'm going to pause. Are there any questions so far or thoughts?
Hey, oh, is it working? Can you hear me?
Yes.
Oh, okay. I was just wondering if you had any advice for advocates when we're in front of teens, if the teens are being kind of withdrawn, how to kind of open up that conversation in a way that's appropriate for teens. Obviously not pushing, but just I know sometimes I've been in front of a teen who's looking at their phone the whole time and I want to be like, how are you doing? But, kind of in a way that kind of, feels good for them.
Yeah, it's a good question. So I think there's two things. I think in that situation, one, establish whether or not the teen is there because the teen wants to be there or because their parents are making them be there, because that's going to ultimately kind of have an effect on whether or not they want to talk to you. And so if the teen is there because their parents are making them be there, that might be when it's appropriate to have a conversation with the parent and say, it seems like maybe they're not ready to talk about it. This is normal. Maybe give it some more time and ask again if they want to come back, or maybe trying some different approaches. If the teen wants to be there but hasn't opened up yet, especially I think, teens can be a little bit weary of adults. And so, it can be a lot harder to build trust and rapport with teens than it is with adult clients. And so I often tell advocates, try to get to know the teen as a person before trying to kind of push them to talk about their trauma or the experience. So if they're on their phone, ask them what they're looking at. Be like, what hobbies are you interested in right now? Are there, I don't know. Again, we don't want to try to be teens when we're not, because they're going to see through us and think that we don't know what we're talking about, which isn't going to help with the trust and rapport. So if you're not really up to date on social media stuff or TikTok trends, you may not want to talk to them about that. But if you are, that might be like a segue. But also asking them what their hobbies are, what extracurriculars are they interested in, what do they want to be when they grow up. So just trying to get to know them as like a person before encouraging them to talk about the trauma. And I see Rhonda says, I think sometimes it's okay to give a teen permission to be quiet. It's amazing how many times I've done that, and it oddly led to building rapport. Be quiet with them. Yeah, I think that that is a really great point too, because I think a lot of teens are, especially if this is like immediately after the assault occurred, there's probably 1,000 people asking them questions about what happened, and they're kind of tired of it. So being in your office may just be a great opportunity for them to get some space. And you can have that silence and let them know, like, it's okay, we don't have to talk. And if that means that they're only there for 20 minutes and you sit in the peace and quiet, then I think that's okay. And maybe next time they'll open up a little more. But I would definitely say most of the time, you're going to have a couple of meetings with the teen where there is a lot of silence or just kind of making small talk before they're willing to open up. So just as an advocate, anticipate that. Oh, good. I'm glad that that's helpful. Any other questions or thoughts so far? I appreciate this peer sharing going on. Okay, if there's anything else, just drop it in the chat or you can interrupt me. Next slide. So we've talked with Dana about normal trauma responses and have a basic understanding of sexual violence. And so Dana acknowledges the information you just discussed and says she now has a better understanding of why Rosie has not wanted to talk to her about what happened and why Rosie may not be acting the way Dana imagined she would be. Dana begins saying that she's angry at the classmate, though Rosie has yet to tell her who it was. She's mad at herself for not teaching Rosie better, and she's disappointed in Rosie for underage drinking and putting herself in that situation. She's wondering, should she punish Rosie for lying and drinking? Dana is also adamant that Rosie needs to talk to the police about what happened right away. So, we're going to talk about some themes that may emerge or conversations that might come up after hearing this. So next slide. So first, adultism. Adultism is the assumption that young people are inferior to adults simply because of their young age. Adults often act on this assumption by limiting teens' access or young people's access to decision-making, information, resources, human rights, and opportunities to voice thoughts. Sometimes caregivers and other adults may not even realize that they're engaging in adultism. It's so common and widely accepted by adults that this is just the way things are. While adultism can be harmful or limiting to teens in a variety of ways, there are some particular nuances we want to pay attention to when adultism shows up after sexual trauma. Advocates and parents alike want to be aware of adultism when working with a teen. It can be so easy to either want to protect the teen or help guide them in the right direction based on their own lived experiences or what we think is best for them. But this can also reinforce to teens that they have a lack of control. Examples of adultism that may show up are assuming that the teen doesn't know what's best for them. So the parent may act in this way by mandating that the teen go to therapy or cooperate with law enforcement. Adults not honoring or validating the teen's opinions or feelings about what happened or subsequent actions. And adults not trusting that the teen can handle what's going on around them. So for example, if law enforcement is involved, parents may want to keep certain aspects of the case or the process from the teen so they don't scare them or overwhelm them. But it is trauma-informed practice for the teen to have access to as much information as possible. If you're working with a parent of a teen, talk with them about adultism. And you don't necessarily have to use that language. You can, help them understand just like the idea of adults not listening to teens or validating their experiences due to age differences and the ways that that's harmful. And you might say something like, I know your intention behind pushing your teen to get a forensic exam and not providing a thorough explanation of what the exam entails was to make sure your teen was okay following the assault, and you may not have known or were scared that if you gave the teen the information, they may say no. But the impact is that this was a decision that they were not able to make. A forensic exam for a teen, especially if they don't understand the process, can bring up similar feelings of loss of control they had when they are experiencing the violence, and it can feel really re-traumatizing. I think it would be helpful to include your child in conversations in the decision-making process when possible to help regain some of the autonomy they may feel they have lost. This can be really beneficial to their healing. How does that feel for you? And that just opens up a dialogue with the parent to say, by pushing your teen to do something, or at least not explaining to them, what's going to happen next, it can be really scary and really overwhelming. So it's just, very helpful to include the teen in the decision-making process. Next slide. When it comes to law enforcement specifically, North Carolina does have strict mandatory reporting laws that state any person 18 years of age or older who knows or should have reasonably known that a juvenile has been or is the victim of a violent offense, sexual offense, or misdemeanor child abuse shall immediately report the case of that juvenile to the appropriate local law enforcement agency in the county where the juvenile resides or is found. This means if you're a parent, caregiver, or the advocate, and you know your child has experienced sexual assault, even if it's from a peer and not an adult, you're required to report this to law enforcement. This is the law and we cannot change that, but there are still things that you as the advocate and the parent can do to help the teen survivor maintain autonomy. So first, you should have informed Dana of your reporting requirements immediately upon meeting her, so she has control over how much information she wants to share. When the time comes, offer to make the call to law enforcement together with you, Dana, and Rosie in the room. If Dana refuses to call law enforcement, it is the advocate's responsibility to do so. It's important for you to inform Dana and Rosie of that and let them know once the report has been made and what they can expect next. Make sure Dana and Rosie understand how the investigation and legal process works. Once the report is made, there is no legal requirement for Rosie to work with law enforcement if she doesn't want to, or for Rosie to engage in forensic medical collection. And so those last 2 points are really important because they're where Rosie can practice some control over the situation. Again, Rosie cannot do anything about the fact the incident has to be reported, but understanding the legal and investigative processes will allow her to make informed decisions about what role she wants to play. And it also sets realistic expectations. Again, true crime shows and shows like Law and Order SVU can give the false appearance that these cases are resolved quickly and in the victim survivor's favor, but we as advocates know that that's rarely the case, and make sure the family knows that so they can prepare accordingly. Again, if they don't have experience working with those systems, they may literally only know what they see on TV, and they may think we're reporting to the police, the guy's going to get arrested, and they're going to go to jail. And that rarely happens, and it takes a lot longer than that. And so it's normal when you're working with young people for anyone to want to see the harmed do or held accountable. But remember that we should always be survivor-centered, even when the survivor is a minor. A teen should be allowed to make decisions about the process, and that may mean they decide not to engage with law enforcement or that they don't want a forensic exam. There's no requirement, after the report is made, if law enforcement says, Rosie, you have to give me all the information and you have to talk to me, Rosie doesn't have to do that. So again, it's important to just let them know that so that Rosie can make those decisions, especially for teens who are older and do have more of an opinion and awareness of what's going on. And it's difficult sometimes for caregivers to accept that their teen doesn't want to engage because obviously they are angry or sad or any other number of emotions about what happened, and they want to see the harmed doer held accountable. But we can validate that, and we can help them understand that the reasons their teen doesn't want to engage in the process might be because, you know, like we talked about earlier, they're more concerned with their appearance with their peers, schoolwork, and their social lives. They may not want their story plastered all over the local newspaper or for everyone to know what happened. Not only that, it can cause a lot of fear and embarrassment if the person who harmed them is someone they still care about, like a dating partner or a close friend. They may not want that person to get in trouble or for them to experience social or punitive implications. These situations are never easy to navigate, but it is important for caregivers to understand why their teen may not want to engage and the impact that it will have on their healing if they're forced into it. There are other ways the teen may feel justice and accountability can look. So rather than jumping to criminal legal repercussions, advocates and parents can help empower teens and provide a chance for regaining autonomy by asking their teen, what does justice look like to them, and seeing if there's another avenue to get there. Any questions about that? This pause is as much for me as it is for you. I need to give my voice a break. Okay, we'll move on. So, yep, perfect. Thanks, Alexandra. When I've worked with parents of teens in the past, the should I punish them question always comes up when the assault occurred while a teen was doing something they weren't supposed to do or breaking a rule, whether it's lying, underage drinking, or being somewhere they weren't supposed to be. And this is a really difficult question to answer because one, I don't have children, to be transparent. So I don't know what it's like to be a parent in this situation. But two, there's not just an easy answer. It's normal and valid for parents to be disappointed or frustrated with their teen for breaking the rules. And we can let parents know that. We can also validate that it's okay to have a conversation with their teen about the rule breaking behavior. It would be ideal and a better practice for the conversation to happen after the teen has had some time to process. So at least 2 sleep cycles after the trauma has taken place, and also take into account what else is going on. Are there police involved? Is the teen probably exhausted from already having told their story a bunch of times? Do they just need to rest? But when the parent feels it's appropriate, the conversation can take place, and the parent may ask the child why they felt like it wasn't safe to tell them about the party, and make sure the teen knows the plan if they do experiment with alcohol. Will the parents come pick them up? As previously stated, while we don't want to condone underage drinking, it is a normal part of a teen's development to be curious and to experience peer pressure. The parent can normalize that while talking to their child about the ramifications of underage drinking and why, that's a rule. Sometimes this kind of goes back to adultism, but sometimes there are just rules in place that parents kind of impose, but they don't ever explain why it's the rule or why they're upset about it if the rule is broken. And so explaining that can be really helpful. And of course, obviously, underage drinking is also illegal, but parents can talk to their kids about that. And maybe the teen wasn't drinking when the incident happened. Maybe they were at their friend's house and they weren't supposed to be. Parents can use this as an opportunity to talk to their children about the reasons it's important for them to know where they are for safety reasons, because they care about them and they want to, know where they are. When having these conversations, parents should still reiterate that they do not blame the teen for being assaulted and that they are not at fault. If parents do choose to ground the teen or impose some sort of punishment, they should make it very clear they're not being punished for being assaulted, but for breaking the other rule. Next slide. So the longer you talk with Dana, the more frustrated and overwhelmed she seems to become. Dana then reveals that when she was in college, she was sexually assaulted by her roommate and has done her best to try to just forget it. But now she's having a lot of feelings come up. Next slide. We should not be surprised when caregivers or other secondary survivors disclose to us about their own experiences of sexual violence. This is not uncommon. If you're working with a parent or a caregiver who discloses while they're there seeking support for their teen, take a pause to switch gears and focus on their needs. Check in and try to get an understanding of where they're at in their healing process. For some people, you may be the first person they've told in many, many years or ever. For others, they may be engaging in their own healing process already and don't want to talk about it with you at all. Follow the lead of the person and keep in mind that this may mean they need primary and secondary support. How does that change the way you interact with them and potentially their teen? So you're working with Dana and you're really focused on Rosie, and then Dana says that she has also experienced sexual assault. How does this change the way you work with her and potentially Rosie? Any thoughts on that? Well, one thing obviously that can come up is a conflict of interest. If the caregiver wants to start seeing you for their own healing, this may mean that it would not be best practice to also be their teen's counselor. And if they tell you they don't want to talk about their own experiences, respect that and keep that in mind as you're talking. So it can go either way. They may want to start seeing you as a primary survivor, and that may mean that you shouldn't have a relationship with their teen as well, in terms of being their counselor, but they also may not, want to talk about it at all. And so if they tell you they don't want to talk about their own experiences, respect that, but also keep it in mind as you're talking. Perhaps at some point during the meeting or down the road, they may be triggered or start showing their own trauma response. Be patient and check in with them by just saying, how are you feeling about how things are going? Is this bringing anything up for you that you want to talk about? If they say no, just move along. If they say yes, take time to hear them out. These are complex situations and there's no one way to handle it. When you notice that someone who has experienced their own trauma may be responding to their teen in a less than ideal way, because of that, show empathy and understanding and try to practice some reframing. Next slide. If you've established that the caregiver who just disclosed would like individual support for their own abuse, talk about what options are available to them and what services your program can offer, whether that's support groups, individual counseling, or referrals to therapy or other healing modalities. If the caregiver and the teen are both going to use your services, it's not best practice for them to be in the same group at the same time or to see the same advocate. And I know sometimes for our smaller programs or programs in rural communities, it can be tough. And that might mean that someone has to wait to be in a group, or there aren't as many counselors to kind of spread them out among. So I definitely wouldn't recommend them being in the same group. So one of the people may have to wait, and you can kind of discuss with them about that while maintaining confidentiality, which of course can be tricky. And they may need to talk amongst themselves. And if you don't have the staff to be able to separate them or not have the same counselor, again, we cannot give any information about what the other person is doing, but it can just be helpful to kind of prepare both of them individually about what things are like at home. If the parent told the teen that they're seeing somebody, those kinds of things may come up and they may want to talk about it. So just keep that in mind. There may be a little bit more of a balancing act. And if you're having any issues with that, feel free to, talk to me about it. And we can provide some technical assistance, but that can be tricky. something to be aware of. Next slide. You and Dana have discussed how she can be there for Rosie, Rosie's options as far as reporting goes, what are normal responses to trauma, and what healing and support options are available to Rosie if and when she's ready to engage in them. You also discussed Dana's healing. Dana said she's not ready to engage in services at this time and wants to focus on her daughter, but appreciates the information. Dana is still struggling with wanting to take control of the situation to protect Rosie and make sure the classmate, quote, doesn't get away with it, but it's going to do her best to respect Rosie's wishes. You close your time with Dana by giving her some handouts of the resources you talked about today in your card. You let Dana know that she's welcome to call or come back anytime. You validate Dana's desire to protect her daughter and normalize this response. You also remind Dana that your program does offer a support group for secondary survivors 2 times a year, depending on interest. Dana asks you to let her know when the next one is. Next slide. Common responses of secondary survivors are things that we've kind of already touched on, but we're just going to take a moment to go over this a little more. Anger, of course, can be directed toward the harm doer or the situation, but it's commonly inappropriately directed at the survivor. We could see this show up when we hear parents say they want to punish their teen for the behavior they were engaged in when the assault occurred. While this is normal, help caregivers recognize if they say they're angry with their teen, ask them about the situation, ask them what about the situation makes them angry. Gradually help them identify that it's probably not their teen they're upset with, but the situation, the person who caused the harm, and they may even be upset with themselves because parents have a protective nature. And again, maybe they feel like they failed in some way and that's why this happened. It's not the parent's fault, and we need to make sure that they know this. So you may have to continually remind them that the only individual responsible for the violence is the harm doer. Knowing that may make them want to have a desire for revenge against the harm doer. And we've already talked about this, but a good reminder that wanting to get revenge on the harm doer may make their teen feel alienated and scared and regret telling them. Secondary survivors are not immune to unhelpful cultural responses to sexual violence or common myths about rape and sexual abuse. This internalized response to sexual violence can cause secondary survivors to feel ashamed of talking about the violence with others or worried about the reactions of others. We talked about how Dana is a single mom and hasn't told friends or family what happened yet. And that might be part of, the process with Dana or with Dana and Rosie, however the clients end up interacting with you, that they're trying to figure out how do they interact with the other people in their lives, because there is a lot of shame and stigma surrounding sexual violence, and that's difficult for secondary and primary survivors. A loss of, guilt and helplessness. The loved ones and survivors may feel like they could have done something to prevent the assault or abuse. A loss of intimacy. I think we see this show up more when we think about intimacy between 2 loving partners. We may see this more when it's a spouse who's sexually assaulted by somebody else, but intimacy can show up between teens and parents in a different way. And it's not uncommon for secondary survivors to feel distance from their loved one who's healing from violence. And they may not understand why there's distance or why the survivor won't just get over what happened. And that kind of goes back to what we talked about before, that there's no timeline for healing. There's no deadline for when things are going to change or be different or be better or be, quote, normal again. They probably will never be normal again, whatever that means. But it's not uncommon for them to feel really distant. So that might be part of your advocacy and support with a secondary survivor as well, and helping them understand where the distance might be coming from and ways that the parent can support the teen even if the teen isn't ready to talk about it. There's also an interruption in daily life or the routine. Parents often plan their schedules around their kids' activities. So if and when the teen's activities change because of the assault, whether that's taking a day or 2 from school or no longer engaging in extracurriculars, the parent's routine may also change. It's a great opportunity for advocacy for secondary survivors to help them cope with the changes, because it can be really difficult. And not only this, but once law enforcement is involved or the teen decides to cooperate with the investigation, they're will probably be a lot of meetings and potentially time that the parent has to take off of work. As an advocate, work with the parents, teen, and the community partner that you're working with to try to minimize interruption in their daily lives if and when at all possible. Some nuances that are important to think about here are when the harm doer is a trusted friend, teacher, or coach. This may have an even greater impact on the caregiver, particularly as it relates to anger or guilt, as if they should have seen the signs. It may be helpful for advocates to talk to parents about grooming and how harm doers who sexually abuse children not only groom the children, but the parents in the community as well. There was probably nothing they could have done differently because the harm doer wanted to gain their trust. When the survivor victim is in college, it can be difficult for parents because the teen may no longer be living at home and for the most part are probably pretty independent, and the parent may be feeling helpless, especially if they don't live near the child's school. But we know that parents typically want to be very protective. So if they're not there on campus, they're not close to their child, it can be really hard to feel like they're being left out of what's going on. So helping parents understand why the teen, again, may not be talking with them, and also helping the parent identify some coping strategies when they're feeling helpless can be really helpful. And the situation causes physical distance along with emotional distance. Further, once the teen is 18 and older, there's no longer mandatory reporting requirements, and that can be difficult for parents to accept, that they're no longer, they have no authority for the route their child chooses to take when pursuing accountability, whatever that looks like, if at all. And this is when it can be helpful for advocates to help parents understand autonomy, the criminal legal process, Title IX, and why some people choose not to engage. This is also a great time to talk about alternative forms of justice. And if the teen feels like sharing and is ready, they may be open with their parent about what healing looks like to them. I think that's really important when we're working with older teens, is your advocacy with the teen may be a lot around, my parents are being really pushy, they want me to do this, they want me to do that. Work with the teen to understand where their parents may be coming from, but also validate that the teen doesn't have to, the survivor has to do what's best for them and what makes sense for them. And your advocacy with the parent may be, again, kind of reinforcing that at that age, they most likely don't want anybody to know what happened, especially if them and the harm doer are in the same friend group. Maybe their sororities and fraternities do a lot of stuff together. Maybe they're in the same like recreational sport on campus, or they travel together a lot for a club or athletics or something like that. It's not uncommon for people of that age, or any age really, to just kind of not want to rock the boat, especially if they have shared friends, because they're worried about whose side are they going to take? Are they going to be believed? All of those things are going to come into play, and the parents may not understand that. They may not be thinking that way. So helping to put that in perspective can be helpful for them to understand why their teen may not want to report. Next slide. When you're working with caregivers of teen survivors, we have to take into account that these are confusing, stressful, and overwhelming times for the caregiver and the teen. And when the parent is sitting in front of us, as advocates, we have the sometimes difficult role of centering the needs of the secondary and primary survivor. This can be challenging when the caregiver is saying things that we see as victim blaming, harmful to the survivor's healing, etc. And that's valid, and it makes sense as advocates, and oftentimes survivors ourselves, to have difficulty hearing non-survivor centered responses. However, this is such a valuable time to provide education, support, and guidance to someone supporting a survivor that can really make an impact. Not to mention what we talked about earlier, and that many parents and caregivers we connect with may have their own experiences with sexual violence, and they're feeling triggered, and their responses may be coming from that place. Some helpful things that we can do to help parents process these emotions is use our active listening skills, such as reframing. That can be really helpful when parents may be blaming themselves or their teen for the assault. Another helpful active listening skill would be utilizing open-ended questions. Think about when you have a caregiver that wants to punish their teen or the harm doer for what happened. Open up a dialogue. Don't just shut it down. Don't be like, that's judgmental or that's harmful. Ask what would be the benefit of this? Try to get to the bottom of what their motivation is. And we also want to give space for the parent to share their feelings and express themselves with no judgment. This may be the only space they've had to really let go and be honest. And even when it's difficult, allow this to happen and then go back to redirect or reframe when appropriate. Whether or not you're also working with the teen, it's helpful to make sure the parent knows the process and what to expect and give plenty of space for questions. You can also provide resources to the parent about what support is available, whether that's support groups, individual support, therapy referrals, or educational resources that they can use. Next slide. So we're going to talk about secondary survivor groups a little bit. You can find information on facilitating groups for secondary survivors in the support group manual, The Power of Social Connection. As a quick overview, these groups can include dialogue on the true nature of sexual violence and debunking common myths about the experience, giving information on common reactions survivors and secondary survivors may have to the experience of sexual assault and abuse, provide normalization and validation of secondary survivors' feelings, allow a safe and supportive space for expressing feelings and reactions that they may not be able to express to anybody else, redirect anger to the perpetrator and away from the survivor, and allow space to discuss feelings about intimacy and patience with regaining intimacy over time. Do a lot of your programs or organizations offer secondary groups? If not, and you are getting a lot of secondary survivors, then it may be worth looking into, and doesn't have to be something you offer as often as primary survivor groups. It doesn't have to be something like the curriculum is going to look different. Maybe it's not as long, maybe it doesn't take place over 8 weeks. Maybe it's just 4 weeks. Either way, I'm happy to talk more about secondary survivor groups and kind of point you in the right direction. But I think it's worth exploring if you are getting a lot of secondary survivors, because there aren't a ton of secondary survivor resources out there. And I think it's a group that can often be overlooked. I see right now we do more individual emotional support or working towards putting groups into place. Great, Rhonda. Well, if you want to talk about groups in general, let me know. Next slide. So to recap what we've talked about today, when it comes to working with parents and caregivers of teens, unless you're explicitly seeing the parent as the advocate, you may have to remind the parent that the teen is your client and you want to center their needs and feelings. Parents don't always know how to respond to their teen who has experienced violence, and it's helpful for advocates to have open, supportive conversations with parents about this. Help parents understand the importance of their teen's autonomy following an assault. Recognize that parents sometimes have their own trauma, which affects the way they react to news of their teen's abuse. And secondary survivors have their own emotional responses and needs. It's important as advocates and rape crisis centers to be equipped to work with secondary survivors as well. Next slide. So here are some references and resources. These are all different manuals and access to resources that I got some of this information from, and that might be helpful for you. Other partners to work with is CAC-NC, Child Advocacy Centers of North Carolina. They're a great partner if you're getting a lot of teens to figure out, is there a way that you can kind of work together? Alexandra said all of these resources are available on Coalition Manager or our website. Thank you. And yeah, that's pretty much the end of the information that I have to give. Does anyone have any questions or want to discuss? And we can stop sharing the slides, Alexandra. Anything that I didn't cover today that you wish I had? Yeah, thanks, Rhonda. I hope this was helpful. Oh, good. Hey, thank you. Well, I'm happy to stay on for another 5 minutes in case people have questions or want to talk about anything, but I don't have anything else. So I hope everyone has a great rest of your day. You'll get an evaluation form and we would love your feedback. And it's also required if you want to get a certificate that you completed this training, you have to fill out the evaluation. So please do that. It's very helpful. Have a great day, everybody.